So, hello, good morning to everyone, or good evening, or good afternoon, wherever you are in the world. My name is André Chen. I'm from Lisbon, Portugal.
And my name is Elena Cerviño, and I'm from Caracas, Venezuela.
And we are here because we want to kick off this series of webinars, so Road to Milan, where they're going to be the ITI World Symposium in 2027. First of all, I invite you to all to be there because it's going to be incredible. It's going to be an awesome event with a lot of cool people, a lot of cool clinicians, a lot of technology involved. So you'll be involved in this great and amazing meeting. Me and Elena, we are going to be there. The idea of this series of webinar is to show a little bit what we are going to talk about. Well, first of all, we are in Lisbon, Portugal. In these 15 minutes, it's obviously impossible to meet us, but if you want to follow our Instagrams and social media channels, you can follow mine, or you can follow Elena's, or you can follow both of us. So you can decide. We like to also invite you to be in our lecture in Milan. It's going to be a great, I think, at least we tried to be a good, 20-minute presentation where we're going to be talking about this ortho and implant synergy. And so there's the background of this lecture is to try to answer, or going to answer, to the question, is there a one digital flux there is combined for cases ortho implant therapy? And the answer is
yes, of course.
Of course it is. We do this all the time. I mean, it's our daily life to have a combined flux to treat the variety of patients that arrive to our clinic. And that involves planning, strategy, and execution. Because although Elena is on the ortho side and I'm on the implant side, we have to treat one patient. And we cannot divide this in, okay, you are an ortho patient or an implant patient. Well, in some cases we can, but in the majority of them, they will need our help. So we need to be synchronized to treat the patient as a holistic point of view. The first thing that we do in order to treat these cases is to transform the analogic patient into a digital patient. And that's obviously done with the intraoral scanner. So the first thing that we have to have is an intraoral scanner that will be combined with the CBCT exams. And this technology and this state-of-the-art digital technology, either on the STL files with the intraoral scanners or with the DICOM files of the CBCT, nowadays they are very robust and then allow very quickly with low radiation doses to set up the case either for ortho and implants. The starting point is this digital transformation of the patient. And if I'm the one who's starting the case, there are a lot of things that I can do. You all know there are a lot of planning softwares in the market where you can place this patient and start playing with tooth proportions and buccal corridors and everything. That is my first part, the statistical analysis, where you basically want to set up the correct vertical dimensions, the aesthetic part. But there is a limitation to this. I don't really know, as an implant dentistry, if the movements I'm doing on the computer can be directly translated to the ortho software. So is after this first digital setup is complete, there is a time where I have to work and ask the collaboration of the orthodontist.
Of course. And on this point, we get all the records because the technology help us to do this, and the patient doesn't need to come to my appointment because I get the CBCT, I get the STL, I get the pictures, and that I can see what is the profile, I'm going to change the profile of this patient, how is his vertical dimension, we need to check the dynamic, how is the shoeing, is unilateral, bilateral, and we can do everything with this kind of technology. Then we have to evaluate where is the position of the mandible according to the maxilla and with the base of the crane. If it's any change that we can help the rehabilitation department to get a better outcome or not.
But it's very important that these exams, they are the same first CBCT that we take. I mean, this is a major improvement because now Elena does not need to go for another radiation for a lateral teleradiography, another panoramic. She can take all these exams from the same software.
And that's why nowadays I took all of these records I put on my platform where I can plan where is the better position of this upper and lower teeth and try to give the information to the implantologist without starting the orthodontic treatment yet. And that's how we integrate and give the patient the better outcome working together instead of let me just see where I can put the implant, and then if it come to me, maybe it will be a limitation of any movement to be a better position of the mandible or the relationship with the upper or lower teeth. That's why we use all this technology that I can see if any of these of my goal of the treatment can risk the bone or the result, then I can really measure how I want to align these tooth to be more aesthetic, like an intrusion, extrusion, whatever movement that I can plan. And then I can make, the last position of this case. But what happened right now? I cannot do a predictable orthodontics because I don't have anchorage. That's why I need the help for the implantologist to start the treatment because nowadays we want short treatments. We don't want this patient to be forever treating with the orthodontics to wait too much for the implantologist. That's why when we plan, we can do a very short treatment with a much better result than if we work each one by their sides. And I can give the implantologist the last STL, what I'm going to put the last position of the tooth, and they can plan the implant placement without doing any orthodontic treatment.
Right. So remember in the past that if this image show up, we had a tough time to place the implant in the correct ortho position. Sometimes, if you're an implant dentistry side, the majority of the mistakes that we see is the implant is too buccal or the implant is too far apart of the last tooth, or because there's a small expansion, sometimes the implant stays inward and there's not enough ceramic, to restore, and you get that phone call from the lab technician, hey, who did this case? So at this point, Elena is giving the last STL file, so I can place this on my implant software. In these cases, I use the co-diagnostics. I'm a big fan of the co-diagnostics. And so the trick here is to have on the surgical arena some sort of guidance where this implant is going to be, but not in relation to what the patient is now. It's in relation to what will be after the ortho treatment. And that is very tricky. So how do we do this? So basically, Elena gives me the last setup, this ones that you see here in the middle, or probably here, because we have a new feature to make these webinars. And you see that in the middle, we have what the goal is. Thing is that if you're going into these merging details of the co-diagnostics, you have to somehow trick the system. You're going to plan on the last software, but the surgical guide has to incorporate the information of the last STL, but the guide has to set on the teeth that were not even moving a little bit. So that's the trickiest part that we do on software. So how do we do this? So we basically merge, as you can see here, the green one is where the position is, and you see the initial position. If you see that the teeth, some of them are going to the lingual side, some of them are going to the buccal side. If we went blind and placed the implants, you can already see a lot of mistakes here. So basically, what we do is we design the implants on the final STL, then we go back and we do the surgical guide with the information of this in the initial STL file, as you can see this. And then we produce the surgical guide. So in the day of the surgery, this surgical guide carries the information of the last STL file of Elena. So I can place my implants in the correct position. You can see here that his implant is a little bit to the lingual side according to the initial part, but we know that this premolar is going to rotate inwards, and so the implant is already stayed in the correct anatomical tooth position. So we place the implant. In this case, we use statical guided surgery, but you can also do this with dynamic surgery. And even if you guys have robots with robotics, the idea is to have something to transfer the position that the ortho made towards my diagnostic. When I'm finishing with the diagnostics, and as you can see that the position, there's a little bit of deviation that we also going to cover in the lecture, the limitations of softwares and mergings and so on and so on. With the same impression, I can see the position of my implants and can start, producing the provisional restorations. So Elena has good anchorage to start the aligner therapy. And fast forward a little bit, then we have also integration done. And you can see here that the lab work is already producing the tooth position according to the STL that Elena gave me. So now Elena can produce the aligners and start moving this to the correct position and to the correct vertical dimension, to correct P curve, Wilson curves, and everything. Right, Elena?
Right, yes. I saw that we already have in one quadrant the space for distal eye, that there is a movement that without any implant it will be impossible. And that's why we already plan. And for me, I don't need to ask for IPR or something orthodontic features to start the treatment.
But these guys want to know the end result, right?
Yes, right.
But we're not going to show it.
No.
Why?
Because you have to come to Milan in
2027, okay? Because we're going to cover not only that, the planning of the implants, but we're going to also cover
these kind of treatments that we are between open the space for an implant or close a space that will help me an implant. And that's why we can have the time to show how is the cases, how step by step, how we do it.
Okay, so we have a combined ortho implant dentistry talk. It's going to be in Milano in the ITI Symposium. And we want really to invite you all to be in May 6 to 8, 2027 in this beautiful city, which I love it. You also
Yes, now you don't have excuses. You have a lot of time to buy your ticket, make the reservation, everything, okay?
And we'll see you there.
Bye-bye.
Bye.